Hi, beautiful people. How are ya? I hope you're having a great day. I don't know about you, but I'm always looking for treatment options that don't require me to take another pill or another medication. I've got enough of that. I've been taking D3 for years, but I haven't been taking calcium. And I recently had a bone scan, and now they tell me that I have osteopenia of my neck and my lower back. So they want me to take calcium too. I found this supplement with the exact recommendations of 1,200 milligrams calcium and 1,000 IUs of D3. And it says it supports bone health and may reduce the risk of osteoporosis, which would be the next step if I can't control it with this treatment. So, one pill, not two, which doesn't change what I'm already taking. It's a huge pill, and I have to take it twice a day now, but that's fine. They slide right down. So it's all okay. But when I started reading about green light therapy, I thought, well, it wouldn't hurt. You can buy these special green lights or buy green glasses, which is what I think I'm going to try are the glasses. So if this sounds interesting to you, let's explore this topic. Here we go. Is this unscientific? Well, I've heard some people say, oh, it's just pseudoscience, and other people say that there are biologic reasons that green light therapy can work on pain for fibromyalgia or other chronic pain conditions, including migraine. Quote, fibromyalgia is one of several invisible diseases, chronic conditions with debilitating pain and fatigue that can't be easily recognized just by looking at someone. It affects an estimated 10 million people in the United States, according to National Fibromyalgia Association, the majority of which are women. Unquote. If you are light sensitive, which most people with fibromyalgia are, then this could potentially help you. Photophobia or light sensitivity affects about 85 to 90% of people with migraine and 70% of people with fibromyalgia. It's very common. In a 2009 study on fibromyalgia, researchers revealed that 84% of people with fibromyalgia had neurological symptoms. There were neurological signs and symptoms that suggested severe neurologic problems. For example, photophobia at 70% of people with fibromyalgia, numbness in any part of the body or tingling in the arms or legs at 54%. And these correlated with neurological test findings. Poor balance, 63%. Poor coordination and weakness in the arms or legs at 58%. Those also correlated with objective findings on neurological tests and statistically significant findings that fibro sufferers had more neurological issues than the control group. We experience so many unusual symptoms that are difficult to explain by science. My poor balance, for example, is perplexing to neurologists. There's no reason this should be occurring. Well, we know it's fibromyalgia, but researchers want to explain it as one of their known neurological diseases, but It does occur in fibromyalgia. 84% of us experience numbness and other neurological signs and symptoms for longer than 3 months. It's why researchers like Watson believe it is a neurological illness. A neurologist was blinded to the fact that the 166 people had fibromyalgia to prevent bias. In 2009, physicians were very, very biased against fibro. Today, this isn't new news. Research suggests that repeated nerve stimulation may cause the changes seen in fibro from brain imaging found in the brain and spinal cord. This could involve an abnormal increase in certain chemicals in the brain that signal pain, or the brain's pain receptors develop a memory of the pain. Yes, genetics, as we know, also play a role in fibro, as well as infections and physical or emotional events such as prolonged psychological stress from a car accident, for example. We also know that if you have lupus, RA, chronic back pain, IBS, ankylosing spondylitis, depression or anxiety, or osteoarthritis, you may be more likely to develop fibro. An innovative treatment option is called green light therapy. If you get migraines with your fibromyalgia, this could potentially be very beneficial for you. But anyone with chronic pain, including fibromyalgia, can benefit. There's still questions to be answered regarding this treatment as to how does it work? But you can find glasses and light bulbs that might work for you. Back in 2017, researchers determined that green light has long-lasting anti-nociceptive effects on acute and chronic pain. That was a rat study. Nociception is the neurological process that occurs when the central and peripheral nervous system processes harmful stimuli. Researchers investigated the effects of light emitting diodes, LEDs, in the visible spectrum on acute sensory thresholds in naive rats, as well as in experimental neuropathic pain. Rats receiving green LED light in the visible spectrum showed significantly increased paw withdrawal to a noxious, meaning harmful, thermal stimulus and anti-nociceptive effect, which lasted for 4 days after termination of exposure. So this study used actual LED lighting. Another green LED lighting study occurred in 2023. It was called GLED for green light emitting diode light therapy. Their results suggested, number one, that green light, GLED, makes ibuprofen and morphine-induced anti-nociception increase its potency. And anti-nociception means blocking the detection of a painful stimulus by sensory neurons. So, if you're getting surgery, for example, they could potentially give you green light therapy to reduce your need for more opiates. That's pretty cool. Number two, their results suggest that exposure to GLED will reduce the amount of morphine dose to achieve anti-nociception. That's nice. And number three, spinal neuroinflammation is reduced after GLED exposure. And four, GLED exposure decreases dorsal horn glutamatergic receptor expression. Well, that was a mouthful, basically. We've heard a lot about the dorsal horn over the last few years. It's a sensory horn in the spinal cord and lateral to the spinal ganglia. It's believed that the dorsal horn is inefficient in managing our senses in fibromyalgia, like with our pain, headache, light sensitivity, etc. Quote, green light therapy consists of spending consistent daily time in the specific wavelength of light known as narrowband green light, with no other light source to interfere. It can be relatively inexpensive, conducted in the comfort of your own home, and no adverse side effects have been reported. And that was in migraine again. Lastly, I want to mention the research on green eyeglasses. So you may not have to sit in a room for hours with a green light source. You can wear special eyeglasses for several hours a day and reduce pain and anxiety. I like that idea. And if you're taking opioids, it may reduce the need for more opioids to manage your severe pain in fibro and possibly other types of pain. In an article by American Society of Anesthesiologists in 2022, green eyeglasses could provide an easy-to-use non-drug option, it says. There's a few non-drug options for people with fibro. So that is what makes this so interesting. In a study of just 45 fibro patients in 2023, so a small study, researchers put 15 patients in a group. One group wore clear glasses, one wore blue glasses, and another wore green glasses. In the green glasses group, patients decreased their use of oral morphine by about 10%. A larger study is needed, but eyeglasses are not expensive, well, generally speaking. Some people responded to wavelengths in the lower spectrum and others in the higher spectrum. And so they obviously tested the wavelengths of the different commercial glasses that they tested and chose what they liked. And I didn't see specifically what glasses they used, but in the lower spectrum, it was between 490s to 510s, while others responded to higher wavelengths. However, the pain scores of people, oops, I messed this up, so let me try this again. The pain scores of people with fibromyalgia did not increase as their opioid use decreased. But is green light effective because it's rooted in being in nature and that feels good? Or is there some other reason? Researchers aren't sure. For some of us, we may think that the blue light would have been more effective because who doesn't like the color of the sky or the color of the ocean with the magnificent colors that's there? Because color does affect our mood. And as a side note, that's the one thing that scares me a little bit and losing my sense of color. I mean, I already see colors as dull or washed out a bit. Not all colors, but many of them, especially in low light, and obviously can't see in the dark. And that's why my husband added that extra light above me, which is now shining down. And that's why you're seeing this lightness and my hair looks more blonde. It's pulling the lightness that's the golden that's in my hair naturally. But that light helps me to see so much better in here. And I want to thank you all for watching that video on creating my studio. I really appreciate it. You all are so supportive. It means a lot to me. Bless you. The researchers, Goller, don't know if I'm pronouncing that right, stated that clues can be found about green light in the cones and rods, the eye cells that sense light, that send electrical signals from the eye to the brain. And that's what's getting damaged in my eyes are those cones and rods. She wants to know more about that. And that's wonderful. Cones and rods are being destroyed in my eyes from geographic atrophy. And actually, the death of retinal pigment epithelium cells support the health of rods and cones as the cause of geographic atrophy, the advanced form of age-related macular degeneration. If that interests you at all, I do have some videos on that. So I would love to learn more about that too. So her studies, she's got future studies in mind of what she wants to do in studying all that. The photoreceptor cells interpret light, but they also signal the brain to interpret and use vision. It's powerful. So future research will focus on the brain and vision and what happens with green light. How do I find these glasses? Well, according to Dr. Goulart from that study, green eyeglasses purchased online or off the shelf may not be beneficial, she says, or useful because they may not use the specific wavelength of green light that's needed. And apparently, they are customizing green light glasses. Currently, I guess they're under development, but that was in 2022. So I'm wondering where those glasses are, where that information's at. I'll have to maybe look a little harder. According to American Optical, wearing green lens sunglasses can enhance vision and help with filtering out harsh blue lights while letting in useful wavelengths, sharpening focus, and enhancing color, contrast, and depth perception for reduced eye strain. You'll get reduced eye fatigue, UV protection, and the green polarized sunglasses enhance contrast and depth perception in sun, bright light, rain, or snow. I love that. I would really love to have those sunglasses. Also, these sunglasses reduce blinding glare reflection off of water for those of you who participate in boating, fishing, and water activities. So that would be nice too. They look very stylish and trendy. There's quite a few to choose from, but honestly, I'm not sure at this point how stylish and trendy I care to be, but that is great. And they can be used every day when outdoors. They don't say that they'll help with pain, so remember that. Perhaps they'll help with mood, though. They seem fun, and maybe that's what it's all about. I provided a link to a website that rates all of the top rated green sunglasses. They're not cheap. They're in the $200 range. However, if you want the best, sometimes you got to spend it. And maybe these are the answer for you. I'd have to budget these out for sure, but I certainly like the idea of when I'm in the car or outside wearing these to sharpen focus and enhance color because currently when I'm outside, I don't wear sunglasses at all because when I'm working in the yard, I can't see with my sunglasses on. They make things too dark. So it would be nice to see contrast and depth perception better, but we'll see if that's the direction I go. Let me know if any of you have tried these or something like these, or maybe you've tried the non-sunglass type of green glasses. We'd love to hear from you if these actually work. It seems that green glasses may help with migraine headache, as I said, that pain and light sensitivity, but is it pseudoscience? Or does it truly work? I'll let you be the judge. So let us know what you think. And it may feel like pseudoscience to you if you're one of that percentage that it doesn't work on. And then there's going to be somebody else who just absolutely loves them. So, again, it's that personal detail, that little bit of something that makes us unique. I hope you learned something. I send you gentle hugs and support. Love you.